Good morning, Senator, and thank you very much for joining us today. It's great to see you, and it's great to have you here for this 2020 award for seniors from the Partnership to Fight Chronic Disease. You know, as you know, from the Partnership to Fight Chronic Disease, we're an organization that's been around since 2008. It's a national organization with state affiliates. Our mission is to educate people about chronic disease and how we can potentially address this, how to mobilize Americans to take chronic management of their own diseases in their own hands, and how they might be able to do that, and work with health institutions on making sure that's done. And then talk to people like yourself who really are the ones that can help us change policies around healthcare delivery and healthcare maintenance, particularly in the chronic disease areas, which are pulmonary, pulmonary, heart, diabetes, cancer, asthma, pulmonary, arthritis, mental health, and obesity. And so we really, really appreciate you being on here today. And at this point, we'd like to present you with the award from the Partnership to Fight Chronic Disease. And holding up...
Frank, I got all dressed up for this, so thank you.
I know you did. And I know, Brendan, you're taking screenshots. So Stacy's holding up the award, and Stacy is holding up the certificate. So thank you very much. And Brendan, I'm hoping you're getting this screenshots and everything like that. And so thank you. Congratulations, Senator, for this year's award.
Well, thank you, Frank, Stacy, John, Tim. It is so good, Mary. It is so good to be on with all of you. And to Krista, could we give a round of applause to Krista Brady, who runs my really remarkable constituent services. We have a lot of people looking to us for help, more than I've experienced in 20 years in public service. And I am just so grateful for the blessing of tremendous, dedicated, active people in my office who Krista leads, who are handling lots and lots of constituent calls, helping people figure out how to navigate Medicare, Medicaid, Social Security, how to access behavioral health, physical health, support and assistance, particularly for those with chronic diseases, is a big part of our work and a big part of what Krista helps lead. So no thanks or recognition would be either appropriate or allowed in my office if we don't thank the folks who are actually doing the work on my team. This is a hard time for our country. We are in the middle of three crises at the same moment, a global health pandemic, but a health pandemic that because of missteps, is having a harder, broader, longer impact on the United States than virtually any other advanced country of our sophistication. And then a recession associated with it that we are just slowly beginning to dig our way back out of or through, and then a renewed focus on inequality in our society. A lot of events in the last couple of months, the brutal murder of George Floyd, but many others have refocused us on health equity, on housing equity, on differences and opportunities. So my hope, Frank, is that we'll work together in the coming months and years to make sure that Delaware is a place where equitable access to health care is a reality. In my service here in Washington, my work in the Senate in Delaware and across our country, providing support, providing sustained and meaningful support for those with chronic disease conditions and for our seniors has always been important to me, but it's particularly important now in this pandemic when those who've got chronic conditions, either behavioral health or physical health, are particularly vulnerable. So thank you for the award. I appreciate the chance to continue our partnership, and I really look forward to working together in the year ahead.
Thank you, Senator, so much, and thank you for what you do for our country and Delaware every day. You're an amazing representative, and I was telling somebody, I said you're one of my top 5 all-time senators, and that's after serving 2. it means a lot that you're here with us today. So what I'd like to do now is kind of go around and talk to each of the people who are representing the partnership in the state. And I'll start at the top on my screen. So that's Mary Fenimore.
So I am Mary Fenimore. I'm with the Medical Society of Delaware, and it cannot be understated the value of what telemedicine has made for physicians and for the people of the state of Delaware and the country, and the uphill battle that was done to try and make sure that everybody has access to care, and that physicians get proper reimbursement and don't have to worry about lawsuits and problems that come along when you have a very quickly put in place telemedicine service. It's been tremendous. There's probably not a person on this call that hasn't been affected to the better because of telemedicine, and your work and all of our state legislators, our representation in Washington has made such a difference for this. So for the physicians, I am not one to just play one on Zoom. Thank you, because we couldn't do it without the partnership that we have, and we're very, very grateful. So thank you.
Thanks, Mary. As I'm sure you know, my appropriations subcommittee includes the FCC. And Ajit Pai, with whom I have plenty of differences, was remarkably responsive in getting about $200 million out in special telemedicine grants, and made certain that Delaware got more than its fair share, which I'm very excited about. I mean, you know, to be really blunt, that's a key part of my job, is making sure that when I have an opportunity. So I have a meeting later this morning that I cannot tell you about in any great detail, but it's with somebody who's got $20 billion to spend on vaccines and therapeutics and health research, and very excited. That's going to be the best meeting of the day, because I've got an idea and it involves Delaware.
Yay!
I do think telemedicine. I think we've talked about it for years. Distance learning, telemedicine, and we have relatively a small amount of genuinely rural territory compared to Montana or Alaska. But as I've talked to other senators about this, you know, this has been talked about for years. It's finally here. It's finally being done, and investing rapidly in the quality and the accessibility. We are actually going to be able to do serious modern quality healthcare at home in a way that's going to transform aging at home, monitoring healthcare, dignity. There's a lot going on, and I'm really excited. Sorry, Frank, I'm talking too much.
No, you're not talking too much. You're actually helping us understand what's going on in Congress and what you're part of, and which will affect all of us in a very positive manner. So thank you again, and Mary, thank you for that probing question. We'll turn it over to John Gardner now.
Hi, I'm John Gardner, Executive Director for AIDS Delaware. We've always been very appreciative of the support we get from Senator Coons for our agency, but more importantly, he's really fighting for our clients. We work both on the prevention and the treatment side of the HIV/AIDS epidemic. And our client base is older. The average age is 55. 80% of our clients live at or below the federal poverty level. And the work that you do at a federal level helps the funding come into our state to care for these people who desperately need the help. So thank you.
Thanks, John. Thanks for what you do.
So, Julie?
Miss Julie,
yes.
Hi, I'm Julie Saville. I'm the Clinical Assessment Nurse Liaison for MeadowWood Hospital. I just want to thank you for your advocacy for the seniors, even though we take care of ages, 12 to 101 so far.
Wow.
I know everyone is impacted by, what has happened so far this year. But, seniors more than anyone, I believe. So just thank you once again, and you deserve this award more than anyone.
Thanks, Julie. And to Julie and John, I mean, I think the populations that you serve are finding, I'm confident that this pandemic is particularly challenging for those who are already at the margins in terms of accessing healthcare, and we have to really be mindful of behavioral health and chronic conditions. Sorry, I'm going to try and not talk too much. Tim, I'm getting in the way again.
Yeah, not getting in the way at all, Senator. These are very important things and things that are critical to both just generally for fighting chronic disease, but during these very, very challenging times. So, without ado, our great friend and colleague, Mr. Tim Gibbs.
Oh, brother, great friend. Senator, it's great to see you, and I have to say that you are one of the people who makes me very proud to be a Delawarean, and thank you for your representation.
Great.
So when the Academy became the affiliate to the American Public Health Association in 2013, there were people who said, well, why is medicine and public health pairing up in one organization? You got that from way back when, and now certainly COVID-19 has highlighted the connection between the two. And to my colleague, Mary Fenimore at the Medical Society of Delaware, it's always great to be in partnership with you. The one thing I would add to this is that the journal issue of the Delaware Journal of Public Health that's out right now is about research in Delaware on COVID-19. It's a two-parter, and later this fall we're doing an issue on racism. So we have attempted to elevate these very important issues and appreciate the elevation that you're providing for us as well, and to everyone else, to Julie and to John, and then certainly to Frank for organizing this. Thank you very much.
Tim, if I could, one of the things I've worked hardest on, I'm having a hard morning because the deal fell apart, and I have really believed for weeks that we were going to get this big package done. One of the things I've worked hardest on is corralling 20 Democrats onto one common $53 billion proposal for a new generation of investment in the public health workforce of the United States. So a loan forgiveness for nurses, loan forgiveness for doctors, professional training programs, funding positions, just to build out the sort of mid-level human resources, infrastructure, public health, and then doubling the size of AmeriCorps and providing 150,000 new positions to do contact tracing and testing and vaccination. I managed to get 8 Republicans to support the AmeriCorps side of it, including people like John Cornyn and Marco Rubio and Lindsey Graham and Roger Wicker. Roger Wicker is my co-sponsor from Mississippi on a $16 billion proposal. And we've been working hard to stand up a chapter in Delaware of a Philadelphia-based public health AmeriCorps program that would have 50 slots for AmeriCorps members from Delaware to help with public health. And where part of the goal, by the way, is to have them not just be COVID-19 response, but to do public health is rooted on contact tracing is how we've dealt with, all sorts of different chronic communicable diseases. And I am increasingly focused on, if we have an effective vaccine early next year, how on earth are we going to vaccinate, 360 million people? So do please, let's stay in touch about that. I don't know about COVID-19 research being done in Delaware, so Krista's going to recognize that I'm an idiot for saying, I'd like to read the latest copy. But I would love to have some brief summary of it.
DJPH.org.
There we go.
There you go.
And that's it.
The Delaware Journal of Public Health.
And that's a two-parter.
Yep. So the first part's out. The second part comes out probably next week.
And actually, it's great because people like Insight, or have submitted articles, and other great organizations from the state of Delaware are all part of this effort. And Tim, thank you and your organization for bringing them all together to talk about what we're doing in the state of Delaware, but what we're doing for a global pandemic and potentially probably an endemic coming out of this.
Yep. Most welcome.
So thank you very much. Senator, I'd like to just thank you very much for being a part of today's presentation, for what you do, for the partnership.
Frank, are we going to let Stacy and Stacy just at least say hi?
Oh, yes, I'm sorry. Stacy and Stacy. Hi, Stacy and Stacy. Go ahead. You can say hello. I'm sorry. I'm very bad.
Hello, Senator. I'll just echo what others said. Mary, I couldn't agree more that your leadership, Senator Coons, on protecting in-home treatments during the pandemic has been so important to many seniors, and as we've discussed, those who suffer from chronic disease have experienced COVID-19 at a level that's just more significant when you have those issues that Frank mentioned: diabetes, heart disease, and any autoimmune conditions. So we also, kind of along that note, really appreciate your work guaranteeing access for the protected classes, as you probably just recently blocked an effort to end treatments for a number of chronic conditions that include epilepsy and mental health, autoimmune conditions, HIV/AIDS, cancer, organ transplant. So I would just echo what everyone.
Thank you, Stacy. Stacy?
Thank you, Senator. Again, just to echo what everybody else has said, really appreciate all the work that you've done on behalf of patients, seniors, those suffering from chronic disease, especially during this time with the pandemic. And we just really appreciate everything you've done for Delaware and for the United States overall in general. So thank you for your efforts.
And mostly the person we all appreciate is Krista.
That's right. Exactly.
Thank you, Krista.
Thank you, everyone.
Thank you, everyone. And everybody have a great day. Senator, if you ever need any of us for anything, please let us know. We're there to help you because you do nothing but help us every day.
Thanks, Frank. Thank you, everybody. Be safe and be healthy.
Bye-bye.